Okay, so some of the more controversial or at least interesting topics that we've encountered thus far had to do, of course, with the MCIT program being canceled by CMS, but also some of the new competition that we've seen in the neuromodulation space. So the three topics are general topic areas, and we can deviate from this, but the three topic areas that we are going to cover or just discuss amongst ourselves today have to do with this new competition, have to do with the plethora of FDA breakthrough device designations, what role that might have played. And then also, and again, not to be overly controversial, not to look a gift horse in the mouth, but looking at the plethora of investments and growing size of the rounds, are we setting ourselves up for failure? So those are the three things we're going to talk about today. And the format is going to be, we're going to do, now we don't have 50 minutes. It's going to be 10 minutes per round. And let's take 7 of those minutes for unmoderated editorial discussion. And the rule is nobody speaks for more than 60 seconds at a time. So Lawden, your job is to buzz when somebody goes over 60 seconds, okay? And then we move on to another speaker. So after 10, and then we'll open it up to anyone from the audience who wants to join into the free-for-all. Okay, so those are the rules. After 10 minutes, we switch to the new topic. But let's start with the first topic. Are there too many players? How many players can the pain space support? Obviously, we've had first the big 3. Well, let's be honest. At first, it was the big 1, or as Wendy Hutton said 20 years ago at the first Neurotech Leaders Forum, the big kahuna of the neuromodulation space was Medtronic. ANS, which later became St. Jude, which later became Abbott, was the number 2 player, and then Boston Scientific, and then Nevro joined, and now we have a plethora of new players like Saluda, Biotronic. We didn't mention them yesterday. They will be in the market next year, and then we have a host of smaller companies, new technologies like ULF. So Jeremy, why don't you start out? What do you think the pain market can support? And we're just talking implantable devices. We're not even getting to non-invasive devices. Let's just start with implantable devices. What do you think the market can support? How many players?
So to some degree, the answer is a lot, in the sense that back in when I was working for MiniMed, there were 17 companies all coming out with insulin pumps. And in part, MiniMed actually became the market leader because of the technological advances. So that's one component. If you can come out with a technological advance, there's always room for you. But the challenge is, you have the Medtronics and the Boston Scientific that are always going to have the largest market share because of the sheer size and force. And if you're a smaller company, you're going to have a small percentage, or you're going to be bought up by one of the big companies just because of the cost of sales and marketing, which becomes really one of the biggest, if not the biggest component over time. So the answer is, you're going to, whether it's healthcare or otherwise, the top few always have the largest market share, and then you're going to have quite a few smaller niche players that are going to have to get more and more niche and going after very small indications and try to really become the big players in a very small niche. So if I have to throw out a number, I don't know,
10 total players in, let's say, the SAS market. Okay, Jojo. There's your minute. Good job. Jojo, what's your thought?
I like race cars. I think that to say that it's really the big 3 or in some cases the big 4 that really represent the market is inaccurate, because the big 3 or 4 are actually acquiring the smaller players, and like you said, becoming distribution and sales and marketing channels. So they're actually working on top of technologies that are being built out initially as small companies. So I think that's to say that that number is limited to just a handful of companies is misrepresented in my mind. And I think as long as the technological advances continue to happen and those advances are meaningful to the people who they serve, I'm a die-little capitalist. I think the market will bear what patients are willing to adopt.
Throw out a number.
I don't believe there is a number.
You think there's no limit?
I think that the market will shake out.
The market will take care of itself.
But how many can spot?
Her minute's up. Okay, here's my 60 seconds worth. Well, for one thing, we've already had one casualty. Okay, let's not forget that Nuvector was a player in the market. Now, there are many factors, and we talked about this last year at the Neurotech Leaders Forum. What makes companies fail? As I mentioned, Victor Peikoff has written an excellent white paper that kind of looks at the factors, factorizes, if you will, some of the factors that will contribute to a success or a failure in neuromodulation. But clearly, we're going to see consolidation. I would be shocked, if Saluda is still Saluda by the end of 2023, maybe even taken out next year. We know for a fact there's already been offers on the table. We know for a fact that the Australian company has turned them down. But the longer they go, the riskier it gets. Again, we saw what happened with the. Oh, my time is up. Okay, you go ahead. Jeremy, your turn.
Same topic.
We're 60 seconds our limit. We'll open it up to the audience. Anyone in the audience want to comment on this? Yes, Alec, go ahead.
What's going to shake out technology? Technological advances are happening rapidly. I think that the big one will adopt, maybe purchase technology, but adopt new technology. I think that we need to remember that spinal cord stimulation, the generators come from pacemakers. No real change until Saluda came around and made a major change, I think, in technology. I think there's room for technological growth, and I think the market will bear it.
Okay, thanks, Elliot. Go ahead.
I think we need to add in the management component, because you can build the greatest widget, and unless you have good management behind that, let's face it, we come from the field of technologists and scientists, and we're not always the best suited to be CEOs, and we don't understand, not all of us have the proper B-school backgrounds or experience trial by fire. So I think understanding that having the right team outside of the technology spectrum is just as important as having the right technology. So who was it that said yesterday, first lesson, first thing you need is capital, second thing you need is capital, third thing you need is capital, fourth is team, next is.
That was the late El Man who said it, and channeled, of course, through his nephew, Jeremy.
Yes.
Okay, anyone, Victor, go ahead.
Yeah, I think, I don't know if it will add more players or not, because those will likely be bought up quickly, but I think the main battle in the next few years will be on improving the lead contact in epidural space. So I think we have at least two companies that are pursuing this, the Microleads and Presidio, and both of these have very interesting and unique solutions. So I think that's where and I'm pretty sure that they will be snatched up by big companies soon, but at least they will stir up the pot a bit.
Stir up the pot, you think? Okay, we've got Dan in the back of the room. Dan, if you can speak up so that the Zoom people can hear.
I think there definitely is a limitation to the number of players, while the market factors may shake them out. If I may be incorrect, but I don't think Nevro has turned a profit to this day and loses millions every quarter. That's not sustainable. Nuvector never turned a profit, lost millions every quarter. I think the investors are getting taken on a ride, and these things are dead end. And you go, look at this giant pain market, but the cost of sales is so insane in the pain market. What you're paying these sales reps, the amount of time on the ground, the cost of making the business work is going to make most of these startups or mid-tier players fail. I mean, I just don't understand how investors can throw hundreds of millions literally at failing business models.
Okay, well, look, since you've brought that up, we have John Shearer, who's in our online audience from Nevra. John, do you want to comment at all? It doesn't have to be in response to what Dan just said, but what do you think the market can
The coffee was racing. I just started talking.
I don't know if John can hear. John, can you hear us? All right, we may hear from John later.
John's on his way over here right now.
He's not far away. He's gonna beat you up.
I think you.
Oh, it's my fault.
Yeah.
Thanks. Loudon, do we have anyone else from the Zoom world who wants to weigh in on this?
Nick,
Okay, Nick, go ahead.
Yeah, I think to expand on Dan's point, I think one of the primary driving factors of how many players the market can support is driven by like clinicians' ability to like manage the knowledge of those different products and their offerings and their like different technological advantages. And I think we actually have some history we can look at there and see that, you know, having 3 or 4 product offerings does seem to kind of be this like limit that's offered in different localities. And so my feeling is that we'll kind of see this general like swelling or flexing where we'll periodically go to these expanded markets like we have now where we have so many more players, and those will get consolidated by the bigger players as they pick the right technologies that are winning, and we'll collapse back to that kind of like equilibrium point. Kind of just flexing on that.
Okay, thanks, thanks, Nick.
I just want to also make a few, 2 comments. One is that when we look at the number of players, the world of neuromodulation in terms of indication has just exploded in terms of areas we never thought conceivable 10, 20 years ago in terms of what indications we could go after. And so as new indications make it through FDA, and they may or may not be aligned with the larger companies, so you may get these smaller companies on their own pursuing those particular indications because they aren't strategic fits to the Medtronics or Boston Scientific. The other point I want to make in terms of just response to it, Dan, in terms of these companies that aren't profitable. I don't know if I've ever worked for a profitable med tech company. Yet, Advanced Bionics was sold for $3 billion, MiniMed for $4 billion, and Inspire has yet to turn a profit, and they have what, $7 billion market cap. There's so much pent-in potential in these companies with that they'll eventually make a profit or be sold. In case of MiniMed, first they were originally trading on the NASDAQ, and then Medtronic bought them up. And even when they were publicly traded, I don't know, maybe Dave, I don't think they were ever profitable, but their sales were increasing like crazy. And in part, it's because of the cost of sales and marketing. It's just astronomically expensive.
And the cost of litigation.
All right, that was your minute, Jeremy. But I want to follow up because on what you just on what you just said. Segmentation will definitely take place. In fact, we saw it this year. Nevro got approval for PDN, for painful diabetic neuropathy. They're all alone in that market right now. They may have competitors down the road, but we saw that. In the early days of SCS, you basically had dorsal column stimulation. That's all we had. And then over time, as new technologies came in, they were able to treat not just different anatomical regions, but different indications and different disorders and different patient populations.
Yeah. A great example would be Mainstay for that in terms of treating nociceptive axial mechanical back pain.
Exactly.
Completely new approach, completely different patient population.
There was a patient population that no one else was treating. So is Mainstay taking market share away from Medtronic or Boston or Abbott or Nevro? Probably not. Maybe a little, but probably not. So I think that could well be how you get the survival of more than 4, 5, 6, 7, 8 pain companies. And again, we haven't even touched on the PNS vendors or on the non-invasive vendors. But we all know that pain is a huge market, and we also know that even with all these players, the penetration of neuromodulation therapies is still very low, still under 10%. So clearly, and I think this came up during the I3 forum in Orlando that NANS sponsored. Instead of talking about, hey, how do we divvy up the current customers, it's how do we reach out to a bigger universe? All right, I think we've got time for one more comment on this topic, and then we're going to move on to the next one. Anyone else who wants to comment? Yes, in fact.
It's kind of a question, it's kind of a comment. Nevro being non-profitable as an example to others, but they're ribbon cutting on a brand new manufacturing facility in Costa Rica. How do you jive those facts? Who makes the decision? Who has the purse? In a company right now in that state? I'm just curious. You read one thing, you hear another.
All right, well, that's a rhetorical question, I think. All right, Ellen, do you want to weigh in? Go ahead.
I have one observation, having worked with 3 startups in this space, is the gross profit challenges. And to answer your question, they're probably doing it so they can get a better acquisition price of their product and maybe make a profit. But right now, when you start up and you're not, the break-even points are so high, and then you throw in the cost of sales, where sales reps are making $300,000 and $400,000 if you want someone from the industry. It's just, to me, crazy.
Okay, thanks, Ellen. That's good perspective. Okay, let's move on to the next question. And this came up yesterday. In fact, during my talk yesterday morning, I mentioned the quote, prescient that it was 5 months in advance of the CMS decision, Paul Violette, who at the MedTech Forum in Dana Point, the LSI MedTech Forum, brought up the fact that FDA was being too liberal in granting breakthrough device designations, and he worried that this was causing consternation at CMS. I don't know whether he had an inside track at CMS, but in fact, CMS made the decision in September to cut the MCIT program. So, Jeremy, let's start with you. What's your view? Was the FDA being too liberal in throwing out these breakthrough device designations?
Well, my answer is yes and no. In terms of, if you look at the startup companies, and it's so hard to get a product to market and so expensive, they need all the help they can get. So it's not only the cost of regulatory clearance or approvals, but then all of a sudden you spend all this time and money, and for an implantable device, $100 to $200 million to get to market. But then all of a sudden you have to put all this additional funding and time to get insurance approval. So to help with innovation, getting these companies up and running and providing 4 years of insurance is a huge benefit, as long as it's not a risk to the patient. So that's the question. So, does a large company with a lot of cash need that type of assistance? Probably not.
Okay, Jojo, what's your view?
I'm curious to know if the reversal or the halting of that decision had anything to do with any pushback from the payers. You've got the payers facing
the payers other than CMS, you mean?
Right, the other insurance companies and the other players in the financial part of our healthcare system, whether the economics between the impact of COVID and all of the research that was being thrown at that at lightning speed, were we just hemorrhaging too much? And the other thing is that this is an old system, and somebody somehow got in there with a novel idea to do something different, and change is really scary in a system that is that big
really scary,
and that old.
Very true. Well, you pose a really good question. My guess, and this is just a gut feel, but my guess is no, is an answer to your question, that it wasn't the private payers putting pressure on CMS, because look, the private players are free to do whatever they want. They don't have to follow the lead most often they do, but they don't have to follow the lead of CMS. I had this discussion with Tim Margenin from MICRA in Cleveland at the Cleveland Neurodesign Entrepreneurs Workshop. Did I get that right? I did not get that, which was an excellent event that took place a few weeks ago. Tim, I don't know if you're online. If you are, you can chime in here. But what Tim said is that, and by the way, Tim, being an ex-FDA person, had, you know, he's knowledgeable on this subject. But his view was that CMS, it was an either or. They didn't have the option of making modifications to MCIT. They had to make a decision: do we accept this as presented, or do we reject it? And from what Tim was saying is, I think if they had the option to make revisions, that they would have kept it in some form. Because clearly, the breakthrough device designation program never would have started without CMS's approval. They were one of the stakeholders. Prior to breakthrough device, the FDA had a program called expanded access. And that was a way to helpfully smooth your way through the approval process at FDA. Well, they got rid of that because they didn't get rid of it. They basically merged it with the breakthrough device program. So I think CMS will, let's not count them out. I think that it's very possible that CMS will next year in 2022 come back to the table and say, look, if we can have a program that specifically responds to, or specifically addresses the Medicare population, 65 plus, which the current or the previous MCIT proposal didn't, right? There was nothing in there that was specific to the CMS population, who they are mandated to serve. And I think, and if there is some post-market surveillance specific to that population, I think MCIT could well be restored in 2022. I don't think there was fundamental and again, this is my gut speaking. I don't have any inside track at CMS, but I think we'll see it revived in 2022. If not, there's legislation in Congress right now called Cures 2.0. And it's the same bipartisan congressional backers who passed the original Cures Act. We have a question?
No, your time's up. You're like way over, dude.
Yeah.
All right, I
Thank you.
cede the balance of my time to
I have a question though,
Fire.
which is, we've obviously seen all the pushback on vaccine development. It moves too quickly. We have too many questions. We don't have enough longitudinal data for me to feel safe. Is there any consumer pushback from technologies that have gone through this at a rapid pace? Has anybody heard anything about, I mean, it seems like a logical thing, which thereby means it's a moot point.
I'll say we get praised for moving fast. I've never heard anybody push back.
So,
But in us.
I'm pleased to hear that.
no. But I think just, is part of the pushback because of the structure. I think, use an analogy, when you buy a new car, it's good for, 100,000 miles or 4 years, right? But there's a cap. So here, where there is a time limit of 4 years, but no dollar cap, right? So, I don't know exactly how many, maybe Jim, breakthrough devices there are, or how much money has been spent on it, but the government likes to be able to control the amount of their spend. So maybe it would have been more palatable if there was a dollar cap in addition to the timeline.
Yeah, that's an interesting thought, but again, it wasn't in the original proposal, so CMS didn't have that choice. Dan in the back of the room. Laden, are you able to pick him up? Okay, good.
Do I?
Go ahead.
Okay, I think only a handful of breakthrough devices have made it through approval, so it's really relatively untested. But I'll give you guys a perspective. We have breakthrough designation for our neonatal device. The two advantage would be reimbursement, and the other is the accelerated path, theoretically. CDRH, just specifically, the rule I'll deal with, is so backed up that accelerated path has no regulations to it. So if you follow 510K, they have to respond in 90 days by reg. A Q-sub, in your pre-submission, no time limit. Our last Q-sub took 8 months to get a response. 8 months. I should have just submitted, forced them to reject
Yep.
it and get that in writing, because QSEBs are non-binding, which we ran into. They said, yeah, this is your clinical endpoint. And then we went to submit, and then the next reviewer went, I don't like that. Breakthrough falls in that category. It's all, they could take 3 months to get to you, even though it's supposed to be a 2-week life cycle. So while I don't know if there's too many breakthroughs, I'll just say my personal experience is it's not doing anything exciting for us, but it's a great press release when you're raising.
Interesting. Okay, so for those of you in the Zoom audience, that was Dan Powell, CEO of Spark Biomedical, who you're going to hear from later today in our panel on psychiatric disorders. But let me just respond to that, Dan. Can I infer from what you just said that maybe it wasn't all that it was chalked up to be? Maybe it wasn't even worth it for you to have breakthrough designation? I don't want to put you on the spot here, Dan, but
I really enjoyed the press release.
His answer. I really enjoyed the press release. That's gonna be in next year's noteworthy quotes. I liked it. Okay. Anyone else, either from the Zoom world or from the room, who wants to comment? Yes, go ahead. Yeah.
So I guess when they cut you off because of the minute you were talking about cures too. So I just wanted.
I was talking about cures too.
Yes.
Right.
So I just wanted to follow up. So I think that I understand why CMS is unhappy, because they have a different mandate. They want to provide reasonable and necessary things versus safe and effective. And I think cures too will fix this misalignment, hopefully, because they will remove reasonable and necessary from their mandate. And another thing it will do is it will actually create a structure called ARPA-H, which will...
Called ARPA-H, is that what you said?
Yeah, will be create something called ARPA-H, which is similar to DARPA, but specifically for
right. I read that.
Marketing clinical activities,
Yes.
which will be toward the senior Medicare population. So that will remove this problem that currently exists. That's it.
Okay, ARPA-H, yeah, similar to DARPA, kind of reminds me of the days 30 years ago when, DARPA became DARPANet became ARPANet, right? And basically, it was Congress with George H.W. Bush that said, hey, we've got this interesting network that's linking universities together. Maybe we can, I don't know, maybe that can become something more useful. And of course it did, it became the internet. So kind of interesting model that DARPA provides us. Okay, I think we may have exceeded our time on this topic, unless there's anyone else who wants to weigh in.
Just real quick, CMS is taking public comment on the revision of that rule, so.
That's correct. That's a good point that Andy just made, is that CMS made a tentative decision. Because they're a federal agency, it's subject to the rulemaking process, which means the public gets to comment. Now, they're free to ignore what the public has to say, but what Andy's implying here is, hey, we're the public. You've got a comment on this? Go to the CMS website and make your comment. Thank you. That's a good point. Okay, the last topic for this roundtable is what I call a plethora of dollars. Will the sudden rush of investment in neurotech startups lead to a .com style bubble where too much is promised and too little is delivered, and as a result hurts the industry in the long term? Now, I'm probably the only one in the room old enough to remember the .com crash. I lived through it. Actually, Jojo and I were both in the tech industry in the 90s, right? I don't know if do we remember the 90s? In the months, then the years and months leading up to the millennium, to 2000, when the .com crash happened, it was just out of control in terms of not just who would invest in what internet startup. For me, the classic was Webvan. They were selling dollars for 95 cents, right? It was basically profit. Who needs to make a profit? We'll just deliver your groceries for free, and what the hell? There were, of course, other examples that are probably more representative. But at any rate, during the dot-com era, everyone was rushing to put money into dot-com startups. And then, of course, they were doing IPOs. And then, boom, all of a sudden it came crashing down. And if you remember what it was like after the dot-com crash, it wasn't easy to do any kind of a tech startup. So is that a false flag? Or is that something that we as an industry should be concerned about? Yes, we appreciate, all of the new interest that we've seen and some investors in Neurotech and BCI startups. But should we be concerned that we're overextending ourselves? Jojo, why don't you start?
Well, I think there's a lot to be gained by the investments made by the high-profile people in our field. Elon Musk,
yes,
Brian Johnson,
yep.
Peter Thiel, names that not everybody, many people recognize as being influential and smart people. So when they invest in our field, we all benefit. And I think that the difference to me, having lived through the crash, the dot-com bubble, that was an unregulated, open season, everybody goes hunting territory. And if you had access to a computer and you could code it all, you could theoretically raise money. I think with a regulated environment, we have a benefit of having more actual IP built in. Actual IP. But I think it requires a sophisticated investor and people who are willing to invest just because it's the hot thing to do. Those are the ones who are putting us at risk. And I think everybody wants to raise money, but I think making sure that we on our side are raising money responsibly helps the field to maintain a level of integrity that the dot-com era just didn't have.
Okay, interesting. Jeremy, what's your views?
Well, I think it's an exciting time because there is a lot of cash, and the more money out there, the more innovation you're going to have. But it has to be smart money, and it has to be at the right time. So and we have to demonstrate successes so we don't taint the industry. So if all of a sudden people are investing on just ideas of neurotech, there's going to be a lot of failures. And the cost of, as we know what it takes to get into this market and be successful. So, and it seems like the investment time horizon in terms of investment into the life cycle, changes depending on where we are. And it's right now, relatively early, I guess, but we need the capital. We got to get the innovation out there and got to get those products to market, but we have to also show successes so we build up excitement, continue excitement in the sector.
I think salesmanship was a big part of the dot-com era. If you were a good salesperson, you could sell swampland in Florida.
Okay. Anyone from our audience who wants to comment on this? Go ahead, Dan.
I don't think there's too much money to go in. I'm with Jeremy. I think it's a good, healthy environment. The abuses that I have witnessed, though, I'll give you maybe 4 examples.
Okay.
Neuronetics, NeuroPace, Electrocore, and Nuvectra. All IPO'd, all their VCs got all their money out. None of them had a sustainable business model, and the people who got screwed was the stock market on the back end. And they lost all the way down on it. I think that's where the abuse is happening. I don't think the money initially going in is wrong. It seems appropriate to get some really good technologies off the ground. It's that quick flip where I have my concerns, and I'm just watching over and over. And my standard pitch, when people ask us what our exit strategy is, we say build a healthy business. And what happens after that is in your control.
Okay, very interesting, Dan, but you realize that you just started 4 arguments unrelated. Nuvectra is its own issue. We discussed that last year. What were the factors that led to that? So maybe more complicated. I'm sure that NeuroPace would give you a strong argument against what you just said about, yeah, sure, the VCs got their money out. That's not a bad thing. That's a good thing. That's why they're investing in the first place. It's true. It's true that the epilepsy market, wasn't the home run yet that everyone wanted it to be. But let's not forget, you were at Cyberonics. You remember what Skip Cummins used to say. Hey, it may be small, but it's a steady market. It's 100 million. Of course, it's a lot more now, but at the time, 100 to $200 million market year after year. Hey, wasn't that bad? So I wouldn't count Neurotech out. And as you know, they have technology that can be used for a number of other indications that they're pursuing. Just again, my 2 cents for it. But you started the argument. Well, we're going to save that one for next year.
Premature IPO is a problem in our industry.
All right, I get that, but Neuropace has been around for a decade or more. Now, you can blame that on the FDA, and of course, with justification. But it's hard to use the word premature and Neuropace in the same sentence, if you ask me. But anyway, who else wants to comment on this? We only have a minute. Actually, we have -1 minute left. We have time for one last comment on the issue of is there a gold rush that's inappropriate? If not, we'll wrap it up, and I'll say thank you very much to our panelists and our impromptu panelists from the room for adding to the discussion. Thanks very much. I think these are